If you're interested in learning more about the root causes of weight gain, metabolic dysfunction, and obesity, you're in the right place. Obesity and weight gain are one of our biggest challenges in healthcare. It is said that 7 out of 10 Americans struggle with excess weight, and 4 out of 10 Americans struggle with obesity. Despite diets, exercise, weight loss medication, and surgery, there are so many patients out there that continue to struggle with obesity, excess weight, and the increased risk that comes with those conditions of cardiovascular diseases, different types of cancers. Studies today are showing us that there is one major root cause that is often overlooked by the standard of care, the mainstream approach, and that is our gut. This is why I wanted to share with you this really interesting picture from a study published in 2021. On the left side, you can see the changes in the bacterial composition that occurred in the gut microbiome and is associated with obesity and metabolic dysfunction. You can see changes that could include reduction on beneficial bacteria and an increase of harmful or imbalanced bacteria. On the right side, you can see the increase or reduction of certain metabolites that are associated to those bacteria. For example, on the third one from the top, increase of plasma LPS, lipopolysaccharides, typically indicates that there is a higher state of what we call bacterial dysbiosis in the gut, which could lead to a chronic inflammatory situation. And we know that there is a very strong association between what happens in our gut, those bacteria, those metabolites, and then our adipose tissue, which is a very much active tissue. In the next picture, I want to share with you from the same study published in 2021, you can see on the top right, you can see how changes in the gut microbiome, the composition, a state of dysbiosis, can lead to either they refer to it as rupture, but essentially what the medical literature is referring to it is an opening of the tight junctions, and that could lead to those bacterial particles, the lipopolysaccharides, to migrate through the gut barrier into the bloodstream, where it causes an immune reaction, such as an increase of interleukin 6, interleukin 1 beta. It triggers a whole cascade of inflammatory pathways. And in the functional weight loss consultant certification program, we dive deeper into the different pathways and show you more of the clinical studies behind how does changes in your gut microbiome are associated with more inflammation, associated with metabolic dysfunction, or associated with weight gain and obesity. Now, I also wanted to share with you this discussion between Dr. Chill and Dr. Ellis, talking a little bit more about how those changes in the gut microbiome can lead to or associated with weight gain. What are some of the strategies that we can might be able to mitigate it, help those patients that go beyond testing and looking into the gut microbiome, which is another option that we go into in the advanced functional weight loss training.
It's really important for us and our patients to understand that maintaining healthy levels of our microbiome, including and ensuring that the microbiome is maintaining a healthy balance and of keystone species, because this is important for resilient microbiome factors, and this is going to support an overall optimal body weight. This is from a 2024 review article in the Journal of Nutrients. This article explored the intersection between diet, the microbiome, and obesity. This is really important to understand so we can explain this to our patients when they ask you, why are you looking at my antibiotic use and why are you looking at my microbiome for figuring out my contributing factors to weight? This is the factor here. And it's because certain microbes are highly efficient at breaking down dietary carbohydrates. We're going to see that in this image here in the middle. It's going to turn it into short chain fatty acids. And then the gut microbiome is going to influence key factors such as appetite and satiety hormones as well. This includes leptin, ghrelin, and GLP-1. That very popular term that everybody starting to understand and your patients are going to ask you about. And then Dr. Sarah mentioned Akkermansia. This has been shown to enhance GLP-1. It's also been shown to help improve gut barrier function, and then it contributes to better appetite control. And this is all part of a healthy microbiome. When you have a healthy microbiome, you can secrete things like short chain fatty acids, the GLP-1s, to help with the appetite and maintaining that healthy weight balance. And then it's also important for insulin signaling, glucose metabolism that we're seeing there as well. And then it's been linked with some strains to help improve glycemic control, such as Lactobacillus rhamnosus, Bifidobacterium lactis. These have all been shown to enhance insulin sensitivity, and then it's going to help with also reducing fasting glucose. This is all meant to ensure that your patients have a healthy and balanced microbiome, and this can set a healthy foundation for sustainable weight loss. And that's the key term here, sustainable weight loss. Most of our patients that come to us may be able to lose some weight, but they always seem to bring it back on, right? So the key term is sustainable weight loss. And one of the ways to do that is to maintain a healthy microbiome and explaining what the healthy microbiome looks like for your patients.
The more that you understand about the root causes of weight gain and the range of treatment options available, the better outcomes you can deliver for your patients. So if you're working with patients who are struggling with metabolic conditions, or maybe you just want to take a more deeper dive into weight gain and the drivers behind weight gain, insulin resistance, inflammation, and the many other conditions that branch off from those challenges, I'm inviting you to check out our functional weight loss certification program. We are in the last week of enrollment. This is a unique 8-week online training that includes on-demand classes, plus one live class every Wednesday evening. Sign up if you've been thinking about it. We also are offering a $2,000 scholarship, only available until the end of the month. So please take advantage of it.
I've been teaching some of the weekly courses with the weight loss program. So we're going to really dive into the core, the root causes of weight gain. From a functional medicine perspective, we have to look at all of these root causes. And many times it's multiple root causes for our patients. That's why they can't keep off that weight. You're going to learn how to identify it. You're going to learn how to figure out how those imbalances look, how they present, which labs to use, how to assess it, what treatment approaches work. We're going to actually show you how to package this in a functional weight loss program. We want to help you with that, both on the clinical aspect and then also on the business aspect. So if that sounds like that's the next step for you, make sure you click on that link, and we would love to see you in that program.
And I'm so glad that you highlighted some of those specific strains, because I think that's the trend that kind of gut health is going towards. I think we've left the season of probiotics for everyone. And
Right.
here's a broad formula that every single person should take. And now we're learning more about the power of being strain specific. And so now we can have, more targeted approaches to support the microbiome and its activities outside of the gut.
Absolutely. And our job as a practitioner is to understand the differences, right? We want to provide information that they can't really necessarily find by just doing a Google search, right? We want to find what's clinically relevant and then how to personalize it for them. And that's why we're talking about these different strains for these practitioners on here.
And so while there are many different strains that have been studied, Lactobacillus rhamnosus, Bifidolactis, today we are going to talk about Bifidobacterium breve. As we mentioned, probiotics have such a broad impact on our health, not just in our digestion or with our gut symptoms, but things outside of our gut health, including weight gain and healthy metabolism. Using probiotics in a way that helps regulate our metabolism, reduces inflammation, and improve our insulin sensitivity can help us create a healthy and a comprehensive weight loss package for our patients. So while probiotics are not a magic bullet, I think we know there's no such thing as a weight loss magic bullet. There are specific strains that have shown promise. And so today I wanted to share some data from a 2023 study that was a double-blind placebo comparative clinical trial that found that supplementing with 5 billion CFUs of Bifidobacterium breve, B3, led to not just body weight reduction, but also a reduction in their BMI as well. And so it involved over 100 different participants, and they were both overweight and obese patients. And they were given this 5 billion CFUs of Bifidobacterium breve for 12 weeks. They took it once a day. And during the 12 weeks, researchers measured their waist circumference, hip circumference, the waist to hip ratio, and all the major markers that we tend to measure when assessing someone's obesity levels, as well as assessing their metabolic health and the presence of metabolic syndrome. And what they found is that in the BB3 group, in the Bifido probiotic group, they saw a statistically significant reduction in body weight and in BMI, as well as a reduction in the waist circumference, hip circumference, and of course, the ratio. It is important to note that they did not notice a significant difference in diet and lifestyle behaviors between the two groups. So I found a study where participants who consumed Lactobacillus fermentum, this is a specific strain of lactobacillus, common in many over-the-counter lactobacillus and bifido-based probiotics. They found that participants who supplemented with this specific strain of bacteria lost 3% of their body fat over a month and a half. And probiotics like Lactobacillus fermentum may help reduce body fat through various mechanisms. So, of course, it includes improving our gut health, so helping our healthy bacteria make more short-chain fatty acids, like Dr. Chill was saying, those anti-inflammatory compounds. But it also can help with modulating hormones and neurotransmitter levels. And that includes GLP-1 and ghrelin and leptin, those neurotransmitters and hormones that are involved in our hunger hormone signaling, as well as potentially reducing inflammation. So those are two different strains of bacteria that research has shown they support a healthy level of a healthy body weight and healthy weight loss. Now, of course, it is so important for us to note that probiotics may not be a standalone solution for weight loss. And as often we see best results when used in conjunction with a comprehensive functional medicine weight loss plan. So let's talk about our supplement recommendations.
This is actually a supplement that I often recommend for our patients while we're working on all of the underlying causes, right? Called Target B2, and it's by Probiotics. And what you want to suggest is having them start with 3 caps daily. That's about 9 billion CFUs. Now, Dr. Sarah mentioned in the previous study at about 5 billion CFUs. So anywhere between that 5 to 10 billion CFU starting point is a good starting point for your patients with that.
I love like Clear Labs, SFI
Mhm.
Health. Their products are just so wonderful. And their Therabiotic line, which, they have different variations of them. Big fan of them. Yeah.
Absolutely. And I mean, we're seeing clinical results with it. That's the reason why we're sharing these supplements. We're not just giving you a supplement that we haven't tried ourselves or our patients haven't tried yet.